Hi everybody, my name's Pete Tually and I'm here on behalf of Telemed Vet to discuss our research into equine injuries. Firstly, I'd just like to thank the organising committee for accepting our publication or our submission for the conference into the concurrent measurement of serum and radiomic biomarkers in the investigation of equine injury. And this is the data that I'm sharing from our pilot study conducted about 14 months ago. Just some background, we started a research and development centre in Ascot, Perth, just over about 20 months ago for the investigation into equine injuries and research and development into some scanning equipment and also offering some therapy for small animals. We had Radiological Council accept our submission for specialised shielded stables, and generally the horses spend 24 to 48 hours with us. Most of the referrals are for the investigation of unexplained lameness, which hasn't, obviously injuries that hadn't, or poor performance in horses that previous and other type of imaging techniques and clinical assessment haven't illuminated, as it were. So we repurposed some NPR gamma cameras. The one in the foreground is a scanner that worked and served me very well in our rural human clinics in the Midwest of Western Australia. The NPR systems, I think, are very good systems, and it's been fantastic to be able to repurpose the units for animal welfare. As you know, they can be integrated to the modern techniques and the Xelarus versions. So I think there's a lot of opportunities to explore here with these scanners. That's Jack, our technologist, in the background. We work with registered veterinarians and orthopaedic surgeons along with their nursing team and adjuncts. And scanning takes about 60 to 90 minutes depending on where we're scanning and depending on the horses. They're sedated with butorphanol and an A2 antagonist. And it's an art making sure the horse is comfortably sedated, but not so much that it want to lie down and have a rest. They also have to pay particular attention to protection of the scanner face. Obviously, a hoof and a crystal is not a good mix. And we also have to take consideration in terms of urinary contamination, as they're not good at controlling that. These are just some examples of some fractures of the left ilium. I just thought I'd mention that we are doing the only 3D imaging, SPECT imaging of the horse's lumbosacral region, which is an important area for us, predominantly because it's a very hard area to image with an X-ray and an ultrasound, given the enormous amount of attenuation that exists from the gluteal muscles and just the overall conformity and size of the horse. It's been very difficult for them to get inside the sacroiliac joint, and it has been quoted and reported that the sacroiliitis and injuries in those areas are really, not insignificant disease leading to unnecessary animal wastage. So diagnosing it early. This is just an area where we can see quite nicely with the SPECT, and we're starting to do some quantitative analysis on that for prediction of onset of injury. This is just a quick video of the horse in action. It's the bright Perth light coming through there, so apologies for that, but generally it takes 6 to 8 minutes. The horses do sway. Even when they're well sedated and they look to the eye to be still, they're enormous lung capacities and they move. X and Y coordinate can be corrected forward motion, but if the horse turns obliquely, then it's all over. We've got to repeat the study. This is a very overly smooth 3D image, volumetric image of the pelvis of the horse, but we're very excited about that because no one else had published that. So we're hoping to refine it over time. In relation to this study, we're interested in these features. This was an image that was provided to us by Professor Chris Whitten from Melbourne, but this is an image of the classic area where horses fractured most catastrophically, which is in the lateral condyle there, in this instance of the metacarpal, the cannon bone. It's a terrible injury that can happen in the middle of a race and often leads to euthanasia. This is obviously another area of a fracture which is quite obvious in the proximal aspect of the humerus, but most often the injuries are in the lower fetlock. As many might know who are interested in horse racing, there is a lot of attention in terms of animal welfare, and particularly what happens to horses after their lives. We're really trying to prevent injury in the first place, or making some type of contribution in relation. Turn your eyes away if you're a bit squeamish, but this is a very this is a case of what often can happen with fatigue injuries that come during a race that horses apply to racing. It's a worldwide problem. The United States has a big focus now, a much greater focus, thankfully, on animal welfare, both for the safety of the jockey and for the care of the horse. And really, their imaging techniques, in my view, in many ways, are really back in the 1980s, and it's a real push to try and get them up into our state-of-the-art. And it's great that we're able to do that out of Australia, I think. There's an international group, the FRAT group, which is working in ways in which they could produce a new big data repository and research tool to try and learn the onset, or learn more about the onset of bone fatigue in horses. Horses don't talk, they can't tell you their leg is sore. And we see a lot of injuries in horses, and I often wonder how they manage to we're looking here, obviously, at the most likely areas of injury in the front, the forelegs and the fretlocks. But we do see a lot of abnormalities in the rear and the hock in particular. Also, just to touch on some background, it's an industry. It's a $4 to $5 billion industry in Australia. It employs somewhere between 60 to 70,000 people, either directly or indirectly. And so injuries to horses, aside from the big wastage concerns, cost the industry significant amounts of money. And so there's a commercial imperative there. We're really focused on the science and the animal welfare. But the important statistic that really catches my interest is that of all the 2-year-olds that were sold earlier this year, 40% of them will be lame by the end of the year. And generally 70% of horses are no longer racing after 3 years. So that's an enormous amount of wastage. And some of them are rehomed, but many aren't. And we get a lot of variation in uptake, and the big challenge in equine scintigraphy, as they would call it, is knowing what hotspot is normal and what is abnormal. Increased activity can often just represent normal physiological adaptation to training as bone adapts itself to the new forces. And so it's very difficult to know what the tipping point is between a normal hotspot and an abnormal hotspot. Where is it now leaning into the pathophysiological range where the bone isn't remodeling sufficiently to avoid breakdown, as it were. So very interested in trying to understand whether these features are abnormal, whether these are within normal ranges. This is a presentation of the knee of the horse, which ironically is called the carpus. It was the carpal bones. Horses run on their toenail, on their fingernails, as it were, and the third finger. And it's very difficult to get your head around some of the anatomy. But in any event, we're trying to understand what all these variations mean. And I think we're really at the early stages. Although equine scintigraphy has been around for 30, 40 years, they haven't had, I guess, some advanced technologies in quantitative analysis, and we're hoping we can make a contribution in that space. And here, obviously, is another example where you've seen quite variations, and the horses aren't lame. Clinically, except, and in this horse here, I think was the one which is lame. Of the fourth horse, obviously you can see a fracture there in the distal humerus, but many of these animals clinically weren't lame. Similar breeds, similar work, and similar age. So just not to get into the weeds in relation to bone physiology, but while you're sitting there enjoying this talk, your bones are breaking down and they're being rebuilt. It's just part of our the machinations of bone turnover. When you increase activity and force on the bone, there's some wear and tear, and that's cleaned out each night, or each day, by the osteoclasts. And then you have the bone resorption cells, and then you've got the bone maker cells, the osteoblasts. And their activity can be measured by the markers that they give out into the blood, the biosignals, biomarkers, very similar to the way our prostate, cancers give off the antigens that we detect with our PSA test. So we are very interested in collecting these indicators of cellular. And so my hypothesis has been to see whether a correlation, or test the hypothesis that a correlation does exist between increased concentrations of these bone synthesis markers, which is osteocalcin, the peptide, and the increased uptake in our bone scans, which represents the metabolic activity of osteoblasts, which is what our radio tracers do. And then we can quantitate that through our radiomic analysis, rather than using subjective values of whether physicians or radiologists might think the uptake is mild, moderate, intense, and so on. So the method was that we had 12 clinically referred horses sent to us for lameness after we obviously achieved ethics approval from UWA, and then we matched them against 3 sound controls, or horses that didn't seem to be clinically limping, as it were. We took blood samples out from their indwelling IV catheter, and then we centrifuged them down at University of Western Australia, and then put them in the deep freeze until we had enough horses and samples to put through the ELISA with the biomarker kits. In terms of imaging, well, the horses are moving, so we have to use dynamic imaging, 90 seconds for appendicular and 60 for axial, and then we spend a fair bit of time painstakingly correcting them if the auto correction doesn't lock in. And then with the processing, we just did regions of interest guided by the orthopaedic surgeons on the lower limbs. For 3 techs did that, and then we did the geometric means. And this is just an example of where we drew. So this is the first phalanx, and this is the joint, metacarpal phalangeal joint. Then we compared them against, as I said, 3 matched controls. Rather than going into the weeds, these are just some markers that look not only at synthesis, but we also wanted to have a look at resorption and also looking at collagen markers as well. Because at that stage in the pilot study, we weren't 100% certain which one we should look into. And so in relation to some results, so the horses in yellow are those which have significantly different marker levels compared to their controls with respect to osteocalcin, which is the one denoted here with BGLAP. So in horse 4, we see nearly a 4-fold increase, 2-fold increase in this thoroughbred 3-year-old gelding, and then a 3-fold increase in this thoroughbred, also a 3-year-old gelding. The horse that really had a high level was the standardbred, the 7-year-old gelding. In terms of relative uptake changes, and when I say relative uptake, so we're looking at the region of interest compared to what we thought was a benign area of bone, or an area of bone which is low likelihood of fracture, which was the femur or the humerus. And in case 4, which had the elevated osteocalcin level, nearly 4-fold, it had a significantly increased uptake in its metacarpal territory. So in the right leg, we saw a much higher level compared to the contralateral limb. And also we saw some changes similar to that, but less obvious in the thorax. This was case 4. This intense area of uptake actually represents what they call a splint bone. So the big bone, the cannon bone, is called the third metacarpal, or in this instance in the foreleg. And then you've got the second, which is the medial, and the fourth, which is the lateral, and this is the lateral. And we did this horse, and it wasn't actually lame in this area. So this was discounted by the vets and just thought to be what they call a pot splint, but wasn't affecting the horse. Fast forward, and this is 6 months later, and the horse in the middle of a race fractures this particular bone and fails. And I think this horse now has been euthanized, but you can clearly see the fracture line. So this was a bone scan in January. This occurred during a race, and then obviously I've done a crude area of co-registration. You can see the intense uptake in that horse. So arguably on the pilot study, it was predicted that this horse was going to fracture. So this spurred us on to do a much larger test. Obviously, a pilot does not a theory make, so we need to do a larger prospective study, observational study, and we're looking to enrol 200 horses, and Group 1 will be of the lame horses, Group 2 will be the clinically sound horses. And we're going to undertake equine scintigraphy and also serum markers with conjunction of the University of Western Australia. So that's currently under ethics assessment and also funding assessment. So in conclusion, my main aims have been obviously to see whether a link exists between the concentration of these bone turnover biomarkers and what we have in nuclear imaging. The beauty is you're getting the markers at the same time as you're injecting the tracer, so you're getting a snapshot in time of two markers at the precise physiological identical points, as it were. The blood test, if it can be found to reliably indicate bone that's under fatigue, that is bone that's out of balance, the resorption and is occurring, and the clean out is occurring at a higher rate than it is that the bone can repair it because the horse has been trained too much. For instance, there's too much strain on the horse, and so the bone is now becoming vulnerable and fatigued. So if a blood test can help identify where that's out of whack, think of it like the alkaline phosphatase for Paget disease. It may spur the physician or the vets to go on to investigate using imaging techniques to see if there is an area of vulnerable bone, because the horse doesn't talk, again. So it's important to give the horse a voice, and I think nuclear medicine can do that. And obviously the potential impact here is that rather than just having a tool that can look for impending fracture, it could also give the trainers and the vets an idea that this horse is now going into a range where his bone physiological health is not at its premium and you need to take your foot off the pedal, and they could monitor the horse's blood results to see whether they're getting a really optimal physiological response. Thank you so much, and I hope you enjoy the conference.